All right, everybody. I think we are live. Let's make sure that this camera, everybody can hear me. Sorry. Obviously, I don't have a crew of people behind me. I'm not a president of the United States either. So, doing everything by myself. But thanks for being here today. I'm assuming it's all ladies today. Maybe there are some men who are trying to help their wives. That will be great. So, I'm gonna tell you what just happened. It could be funny for some of you if you experienced that before. Um, I was trying to print my talking points, and it didn't print. I was trying to print it and tried everything, and then I said, you know what? Just go the old school way. Just turn it off, turn it on. Right? Well, it worked, but then it printed like 100 pages because I clicked on print like so many times. Now I don't have any paper. So go figure. All right. So today we're going to talk about the vaginal health. Super important when you have diabetes. We're going to talk about predisposing factors. Why do you get, vaginal infections? It could be urinary tract infections or vaginal infections. It could be bacterial infections, fungal infections, right? We're going to talk about some treatment with medications and holistic remedies and prevention. And we are going to talk about foods high in probiotics. I'm sorry, not antibiotics. Foods high in probiotics. So, probiotics is going to be a bigger part of this today's talk, and the prebiotics as well. But there are other things definitely we'll talk about. So, by the way, for the live event, for those nice people who actually registered and decided to be with us today, we have a special event. We actually are happy to announce that now we have a product called V Happy, and that is called Sugar MD V Happy. If you go to our website and just in the search button, just type vaginal, you will be able to see the product. And we have actually, as of right now, from 8 to 10 for 2 hours only, we have 30% off for you guys. So you're the only one. We're not announcing this to anyone else. You're the only one who will know that there's 30% off on this vaginal health product. So, having said that, let's get started. So, predisposing factors, right? So, why do we get those problems? It could be vaginosis, like I said, candida, urinary tract infections. Microbiome plays a huge role. So think like this: the microbiome, like they have their own kingdom, right? There are good guys, there are bad guys, and they live together, right? So just like us, there are criminals that are walking by you. They may be smiling at you. You smile back. Yeah, you should. But maybe they are criminal. Maybe tomorrow they're gonna come and kill you. Well, if I tell this to my wife, she'll be like, ah. So anyway, but it is true that we live among some not so nice people. And if those people are too many, what happens? Well, if they dominate, then the destruction, the chaos will take over, right? So we don't want the bad bacteria to take over. Believe it or not, we have more bacteria in our body than our own cells. You heard me right. We have more bacteria in our system than us. So they actually dominate us. So now you can understand the importance of the bacteria in our system. And they actually change our genes. We actually get their genes to our genes. So you better have nice bacteria. Otherwise, you're going to mess up. So, anyhow, another risk factor, and that's no brainer, right? So if you have a urinary tract infection, somebody said it's blank. I'm on the studio, right? Yeah, you guys can't see me, right? It's not blank. Okay, I'm just trying to also look at the comments here. Anyhow, if you have any technical problems, just let me know. Like I said, this is a one-man show here. Although Carlos, my manager, is supposed to help me, but I'm not sure. So if he's still there or not, we can see. And okay, I'm sure you can hear too. Then, okay. So history of urinary tract infections and fungal infections. So that's true in any life, right? So even insurance companies will treat you the same way. Like if this guy had tickets and accidents, probably he's gonna have it again. So let's increase his premium. So urinary tract infections, if you had one, that means that you are prone to it. Now, why are you prone to it? There's a different story which we'll discuss. But definitely having that one time, one problem will predispose you to another one. Now, of course, most of you are diabetic. The high glucose will reduce the mucosal immunity. As our body is full of mucosa, the internal part of our, we have external skin, and the inside we have the mucosa. And that mucosa is very important for our immunity. And when you have high glucose levels, that mucosal immunity will be lowered. That will happen in the bladder. That will happen in the vagina. So any hollow organ, I would say we have a mucosa that any cystic structure or any hollow round or structure, we have a mucosa inside that, so that the things don't get in right to your system. But high glucose levels, even so, if you're diabetic, right, and your numbers are good, that is very good. But if you're diabetic and you're doing all sorts of things to prevent urinary tract infections, but you don't do a good job with the high blood sugars or spikes in your blood sugars, then you will still have a problem. Now, another thing that a lot of you are on, a risk factor, is SGLT2 inhibitor drug class. What are they? The Jardians, the Invokana, the Steglatro, the Farxiga. These are the agents that have been very popular, and it's for a reason. There are some studies saying that these agents will reduce the risk of kidney failure in the long term. They will reduce the heart failure if you already have heart failure. However, the same studies also say that these people tend to have more urinary tract infections, a lot more. These people tend to have sepsis or septic shock from these urinary tract infections. The same studies also say that these people also have more bone fractures and dehydration and acute kidney failure, not chronic kidney failure, but acute kidney failure. But in general, in a patient that is correctly selected, the benefits will outweigh the risks. That's why we sometimes use these medications. However, as you know, in our channel and in my clinic, medications are not the number one cause. However, one thing that I notice, that patients who come to regular doctors, and I'm considered a regular doctor, although I'm integrative, but most patients who come to me, come to me from their local referrals, and they just expect a medication, and they are trained in their head that I am broken and fix me. Hey, what I have diabetes, fix me. I have urinary tract infection, fix me. Give me an antibiotic. I have a cold, give me an antibiotic. That's what doctors are supposed to do. That's what the patients think that doctors are supposed to do, because prevention is not emphasized. That's why I am going to talk about the predisposing factors and prevention methods before we jump into treatment methods. Now, we talked about the bacterial dominance, the good bacteria. When your good bacteria dominates, the bad bacteria stays silent. The fungus stays silent. All of you, ladies, have fungus. Men too. You have fungus in your vagina. So, and you have bad bacteria in your vagina as well. And then if you are, not having a good diet full of probiotics and prebiotics, which I'll explain to you in a minute what they are, then you are going to continue to build the bad bacteria, and that's going to just invite the other bad bacteria, right? So vaginal pH needs to be acidic, more on the acidic side. That's why the probiotics, they actually make lactic acid. That's actually one of the primary things that they help you with, is by making lactic acid, making the environment not so friendly to the bad bacteria. And the estrogen, lack of estrogen. Now, so most of the people who, especially women, right, they get type 2 diabetes. That happens generally after menopause for most. Some of them are earlier. I mean, I see type 2 diabetics in their teens and stuff, but majority of the population are after 50s. And this is the same time, where women goes into menopause and they get vaginal dryness, and that is generally a big risk factor. So because estrogen, when you don't have estrogen, you're going to have a thinner mucosa. Thinner mucosa means thinner immune system. And you're going to have less of a strength in your urethral muscles to expel the bacteria. And estrogen also help the good bacteria thrive as well. So estrogen all around a good hormone, although women are scared or they made scared of the estrogen based on some old 20, 30 years ago a study. And then once you scare somebody, they're totally scared. So that includes doctors actually. But for example, I highly recommend using a vaginal estrogen, which is not systemically absorbed. That will help your vaginal mucosa. They'll give you the lubrication. They will reduce the risk of infections. That may actually help with your intimacy as well, because after menopause, although women's sex drive goes down, the vaginal lubrication goes down, but they're still married. They still have a husband, and you don't want them to cheat on you. So, it's not a bad idea sometimes, right? So, and some lactobacillus. We talk about probiotics, but not every probiotic is the same. Even the quality of the probiotic. So think about it. These poor guys, the probiotics, they have to go through your intestinal, your stomach, your intestine. They are harsh environments, right? A lot of acid and stuff, and they have to make it to your colon, which is where the real, bacteria lives. But most of the time, your stomach, your intestines don't have much bacteria. Small intestine has some, but the majority is in the colon, right? So that's why a lot of people get colon cancer. Yeah, you guess it right. Because again, that improper balance of bacteria leads to problems, colon cancer. Now, I don't know what carnivore people say. I don't know what keto people say, but there are a lot of studies that suggest that the protein, the animal protein, and the substances that are produced from those proteins actually feed the bad bacteria. And there are countless of studies that says red meat will increase the chances of colon cancer. Yeah, if you just eat only red meat, your blood sugar will go down. But again, those people are so unidimensional. They are not holistic at all. They just think that there's a problem, it needs to be fixed. And again, the same mentality, fix me. Okay, just eat meat and you'll be okay. You'll be okay from a blood sugar standpoint, but we're going to lose all the prebiotics. So let's talk about prebiotics. What are the prebiotics? Prebiotics are the stuff, the food that feeds the good bacteria. So you buy a nice flour into your house, right? You bring a nice flour, and you don't feed the flour, and you don't give water, you don't give plant food, whatever. You don't give sun, it's gonna die, right? Same thing. Your probiotics needs to be fed, and that is called prebiotic. Most prebiotics, 80% of them come from okay, you can kill me now, carbohydrates. Now, having said that, not simple carbohydrates. I'm not talking about that. The complex carbohydrates, the complex starches that are not easy to digest because of its high fiber content. Fiber is a carbohydrate, okay, ladies? Fiber is a carbohydrate, but it is a non-absorbable form. So you don't absorb it. What you do is you donate. You donate to your bacteria, and they eat it. The good bacteria, they're happily ever after. They grow, they multiply, they reproduce, they have kids, they have families, they love it. They have their own, kingdom down there. And I say down there, I mean, it's your intestine, but also your vagina too. So it is important to treat them nice, feed them. So another thing is, there are, the fiber in the food we talked about in the carbohydrates is very important. That's why I think that I'm connecting this to colon cancer as well. So when you have a lot of fiber, people who eat a lot of fiber, which comes from, the healthy carbs, they will have less likely to have colon cancer and actually in many type of cancer too, by the way. So, having said that, we have other risk factors such as antibiotic use. When you use antibiotic, it's like a chemotherapy. Okay, so you're given a chemotherapy. Let's say old school chemotherapy. Newer chemotherapies are a little bit better, but old school chemotherapies, and they're still using this for breast cancer and some other cancers. What do? They basically kill every cell that replicate fast. Okay, Well, guess what? Bacteria replicate fast, and your intestinal system replicate fast, your hair cells, your nerves, so you're basically getting all the side effects of chemotherapy because you are killing your own cells as well. Now antibiotic is not any different. You're taking an antibiotic, you are killing a lot of good bacteria. So that's why I always try to tell people, and people don't want to understand. I'm like, don't take antibiotic unless you have a fever, unless you have a real infection. Just because you have a little sore throat, unless it's a strep throat that's proven. If it is a viral, which is 95% of the time, infections are viral. But you are forcing your doctor to give you antibiotic. And doctor, what? You know what? I'm like tired. I want to go home. I'm not gonna argue with this lady. Here's the antibiotic. Well, he didn't do any favor to you. You think he did, but in your head, you win, but you actually lose because antibiotic use will kill your good bacteria everywhere. That's why some of you also probably already know that when you take antibiotics, sometimes you almost immediately get the karma. You almost immediately get the fungal infection or diarrhea and all that. Why does that happen? Think about it. Diarrhea, if you're having a lot of diarrhea and constipation, for example, that is again not having a good microbiome in your flora. It's a very good sign that you need more probiotics. Now, well, that's one of the reasons that in the V Happy, the Sugar MD V Happy, that we have a sale right now for the next 2 hours, has a ton of probiotics and prebiotics. Other risk factors: immunosuppression, prednisone, right? So any inflammatory disease, you have a COPD, you have Crohn's disease, you have some even cold. I see like some urgent care centers giving patients like prednisone. Okay, well, why do you do that? Well, it reduces symptoms, but also reduces other things too. So you're predisposing the patient to actually other infections. So even if you use steroids, please do not use more than a few days. If you are genetically prone, if you have allergy problems, if you have eczema, and if you have sensitive skin, these are all the signs that you actually have a tendency to have infections and bad bacterial flora. If you're pregnant, for younger patients, and excessive use of estrogen, progesterone can sometimes lead to that because it's excessive. But like I said, a little bit of an estrogen actually helps a lot. But in pregnancy, your estrogen levels goes like 200 times the normal level. So, and same thing with the birth control, if not as much as pregnancy, but your hormone levels go up like dramatically. So we use oral contraceptives for the known purpose, but it really has no other purpose. If anything, it gives you migraine, it gives you a headache, it makes you gain weight, it kills your bacteria. It's just all over. Not a good approach for contraception. However, like condom use, for example, especially if not well lubricated, it is going to cause irritation and problems in your vaginal flora as well. If you already have a dry mucosa and you're letting someone use condom, that may not be a great idea. Also, just to keep in mind. So let's talk about the treatment with medications and holistic remedies. Well, I would say eliminate the predisposing factors we just talked about here. Okay. So that's number one thing. Of course, if you have a fungal infection that's nasty, you have like, say, white discharge, that is typically a fungal infection. If it feels like fishy or like, bad smell, that's typically vaginosis. That is another, vaginal flora disturbance. Happens a lot in pregnant women as well, again, from hormonal disturbances. But you have to sometimes have the antifungal if you didn't really take necessary measures and you ended up with fungal infection. Again, fungal infections will happen only because you have the correct environment for fungus to thrive and dominate over the good bacteria. And we discussed about this. We said we have to have good bacteria dominating. We have to make sure that our immune system is good, and the immune system is affected from high blood glucose levels and many other things we discussed, right? So And also, if you are like prone to it, or if you are, if you don't want to get the infections, let's say you're on these SGLT inhibitors, and just because you didn't get an infection, sometimes people will tell me that, I'm like, hey, do you remember you have a risk for urinary tract infection for on Jardian? So like, no, I never had it. Well, you didn't have diabetes before 5 years ago as well. So things, just because you didn't have it doesn't mean that it's not going to happen. So when the right environment, it's like a hurricane, like perfect storm. The hurricane only happens in certain seasons and certain conditions for a reason. The things have to come together. And although you don't have hurricane for, say 9 months in Florida, does not mean that you're not going to have it in the next 3 months. Or just because you didn't have hurricane for 2 years in a row doesn't mean that it's going to happen. It's not going to happen in the third year. So understanding the risk is something that most people lack, I think. You know, anything that happens in our health happens because the risk factors come together and defending factors go down. So nothing happens. The fungus will not just, jump under your pants and then just try to go to your vagina. No, it doesn't work that way, really. There are some infectious diseases, sort of sexually transmitted diseases and stuff like that, but that's a different story. But most of the time, these, you know, things that happen out of nowhere is typically from the imbalance in your physiology in your body. Now, also, cranberries, right? Cranberry extract. I used to laugh at this to my patients when I was in medical school. When you're in medical school, you think that you know everything. So, and then you go to residency, you think that you are God or something, and then you go to fellowship, and you start mellowing out. It's like, I don't really know everything, and then you start practicing, and you start realizing that you don't know a lot of things. So that's why lifelong education is lifelong. And I think me educating you is educating me at the same time. So, and hearing you, listening to you guys, your comments, seeing in my clinic, all very helpful. It's like a very enriching process. Now, cranberries, they inhibit the adherence of the bacteria on the vaginal wall and the bladder wall. And xylo-oligosaccharides. There's oligosaccharides, polysaccharides. These are basically resistant starches and fibers, some polymers that are going to be, again, the prebiotic to help your probiotics to thrive. Not every, by the way, not every prebiotic is a carbohydrate or a fiber. Sometimes even omega-3 fatty acids can be a prebiotic as well. As you can imagine, bacteria, they are a being, and they probably enjoy different things like we do, right? And although they are single cell and everything, but they end up being smarter than us. So go figure. They know what to eat. Let's put it that way. So we talked about probiotics and then lactobacillus. So not every probiotic is the same. So if you are buying a probiotic or a vaginal health product, make sure that it has the lactobacillus rhamnosus. And there are some other lactobacillus species that combined together will be good, because not every probiotic bacteria will do the same. And actually, from person to person, it may change. And some, for example, depending on your genetic background, how much probiotic you need daily, for example, also may change. So normally, 10 to 20 million is great for a lot of people, but some people will require 50 billion of probiotics to stay healthy. So if you are having problems, just increase your probiotic, because there's no one single dose that fits all when it comes to that. Now, there are also, from a prevention standpoint, for recurrence prevention, there's boric acid. And that, you can use it as a suppository, like you can insert in the vagina. That helps with the vaginal acidity as well. But of course, there are other simpler things, right? Sometimes we forget about simpler things and jump to the final thing. Like a lot of times people will tell me, hey, this antibiotic, the fluconazole you gave me, it works great with one pill. Why don't you give me 10? And I know why they're asking that, but I'm like, why? And they're like, well, every time I get a fungal infection, I'll use it. I'm like, why don't you prevent it? Right? Isn't that better? So a lot of times, some people like those Jardines and Farxiga. They say, they lose weight, and and that's the primary driving reason for most. But sometimes it helps with the blood sugar as well, quite a bit, and they like it, and they don't want to give up on the medication, but they want to keep taking antifungal instead of, using probiotics, the hygiene things that we're going to talk in a second. They just ignore that, right? So I think I'm glad that you're here, that you're not going to be one of those patients. Urinate frequently. Of course, to urinate frequently, you have to drink enough. So don't drink to a point that you intoxicate yourself, though. I mean, again, urinate enough, like maybe every 4 hours is a great time period. If you're urinating every 2 hours or by the hour, that's maybe a little too much. And practice good hygiene. So there are simple things that people don't pay attention to. I mean, cleaning from front to back, right, is going to help you a lot. I tell people, even especially if you're on Jardians or if your blood sugars are uncontrolled, you are basically urinating a lot of sugar, and that sugar, number one, destroys your immunity, destroys your good bacteria, and then just feeds the bad bacteria. So as a result, you're going to be prone to it. So you have to be extra vigilant, and, for example, use wet wipes maybe to clean it. And then make sure that you're always from front to back, not from back to forward, front. And avoid certain products. A lot of people like do vaginal douching. They do all sorts of things. They stuff a lot of things in there. I'm like, don't. You're bothering the residents. They live in there. They have a home. Don't bother them. It's like, what happens if somebody just pokes? I tell my son sometimes, he sometimes plays with these lizards, like pokes things on them. I'm like, hey, what if somebody pokes something on you? Is that fun? No. So sometimes, excessive cleaning is not good. Vaginal douching is not good. Putting products in there to make it smell good or whatever. There's a lot of products that are selling nowadays. May not be good. So, feminine products, tampons, and all sorts of pads sometimes could be, because anytime you are creating that humid, warm environment, you are inviting the bad bacteria and fungus to grow. And wear cotton underwear, because cotton is good, breathable. Again, there are a lot of sexy things out there that they're nylon, and they don't help you by any means, because they are, again, trapping the bad bacteria and preventing the air circulation there, I would say. Now, foods. Let's talk about the foods. Probiotic foods, right? A lot of people ask that, and a lot of people, I'm surprised, don't know. A lot of people know yogurt is a probiotic. And having said that, not every probiotic food is always probiotic. Why? Because they treat them, okay? So, for example, when you pasteurize a milk or any product, what is pasteurization? Killing bacteria. So you're killing bacteria. So make sure that there are active live cultures. So when you look at the label, that's what you have to look at: active live cultures. Kefir is another one that is way more probiotic in there than the yogurt, which is great. Kefir is something that has Mediterranean origin, which I'm Mediterranean, so I like that. For people who have been here for a while, are probably used to sauerkraut. A lot of people like sauerkraut, so that's fermented cabbage. A lot of fermented products are good as long as they are not treated. Again, like wine is fermented product, right? The beer is fermented, but they are treated and they remove the probiotics. I don't know why, but they do. So, for example, you cannot say, oh yes, fermented products are good, let me just drink some beer. It's not going to help you. If anything, it's going to hurt you. So kimchi, kombucha, these are some Japanese stuff, and they actually help. Miso, a fermented soybean. So yeah, I mean, Asians actually do a pretty good job with that. Maybe that's why they're healthier. I don't know. I mean, tempeh is another one that is, some people, it's very protein rich. Some people use as a meat replacement. Yeah, but that's pretty much it. I mean, I will take your questions right now, but like I said, we talked a lot today about everything. Finally, like I said, what time is it? 8:30. I think I'm good with timing today. So until 9, until 10 o'clock, we have the sale, 30% for V Happy at sugarmds.com. So also someone earlier saying that research, come and join the research group. So I have another initiative, and we actually established another company just for this initiative, and it's called Diabetes Reversal Formula. You may have received an email, you may receive another email, but we are basically doing research using you guys, right? Isn't that great? Because we have a good community, and my purpose is never to just sell supplements. My purpose is to be a community, to help each other, and to beat this disease and stay overall healthy. We want to reverse diabetes, all of us, right? For some of us, it's possible. For some of us, it's not possible. We want to come up with a program that's going to be 2-month program that is going to reverse diabetes. However, again, I want to listen to you. I want to hear from you. I don't want to dictate to say, okay, I'm the doctor, you're the patient, you do this, and your diabetes will be reversed. Well, it may happen, and it happens sometimes. However, what I say does not, basically go along with, or fit the lifestyle of a certain individual, or they just don't understand why they are doing it and they give up, right? So we are basically creating a program where what are people's problems at? What kind of program they want? What kind of learning would they want? I mean, to be honest with you, the content that I publish on YouTube is for YouTube. It is not always 100%, because if I create 100% training videos, guess what? YouTube will not promote it, because to YouTube it is boring. And for a lot of people who are looking for 5-minute, 2-minute miracles, those videos will not fly and nobody will see them. So unfortunately, in YouTube business, we to try to get more people in, to try to at least lay more eyes on us, to introduce our real, like the book, the real educational material, our blogs. Subscriptions get to our newsletter, for example, so we send you some information there. But those are more valuable information than sometimes what I give on YouTube, because again, YouTube content is a YouTube content. A lot of people rely on YouTube and Google, but again, at the end of the day, YouTube and Google are there to bring customers to their platform, and to bring the platforms, they will just promote whatever people are clicking. And unfortunately, a lot of people are clicking for things that don't matter. So I hope you understand what I'm saying, because if I didn't do some popular content, you would not have known me. I will be like 2,000 subscribers for the last 5 years. So this is the game, unfortunately, and I'm being honest with you. But with this diabetes reversal program, we are going to get to the bottom of it. It's not going to be just another like YouTube video type of thing. It's going to be very serious. It's going to be 2 months with a lot of people, like the coaches, the trainers, me, some other planners. It's going to be a whole program, but we don't want to rush it, right? So make sure you subscribe to it. Go to diabetesreversalformula.com, and you can subscribe there. And then we're going to send you some, notifications as well. So let me get your questions here. I'm sorry if I took too much of your time today. And I think I can relax a little bit now. Bring the microphone closer. Okay, out of the way a little bit. Oh, that's actually in front of you. Oops. Okay, here we go. That's better. Okay, so let's see. I'm going to put the comments on the screen so you guys can actually see it. There are a lot of comments, but I'm going to take the questions, okay? Let's see. Somebody said HRT pellets restore my feminine health and libido. Now, I want to give you a quick thing. This is not really pertinent, but I get a lot of questions about this. Hormone replacement therapy pellets, okay, can be good, but sometimes I see a lot of problems, because what I see is the testosterone levels are in the men level, which can cause significant problems. And once the pellet is in you, it is really hard to adjust. A lot of times it's very highly dosed, and they're very expensive. Insurance doesn't cover it. you're paying a lot of money down. So it's something to take it with a grain of salt. I'm not against it, but it doesn't always work great. Let's see. Somebody said, it is an embarrassing question. It burns down there, but doctor says there is no infection. Is that normal? Well, again, doctors are doctors. They are trained to test. And if they don't see anything, they're not going to treat you. So the reason that you're having the burning down there is more than likely there is something bothering, like it could be dryness, it could be some sort of like a marginal fungal infection or some colonization of another bacteria that that you may not doctors may not diagnose, or they might not show them on the test. If it is not showing on the test, guess what? Good luck to you. So again, if you take the measures that we discussed today, I think that will go away. All right. So does cranberry work, which we already discussed, right? Cranberry extracts work by reducing the chances of bacteria attaching to the mucosa. And yeah, somebody said, I don't recommend Jardians at all if you are especially suffering from UTIs. Correct. I mean, I don't really start Jardians or Farxiga if you already have a lot of UTIs. But guess what? If you go back and fix that problem based on today's video, and then come back and say, hey, doc, great, I don't have infections anymore. I'm clean for 6 months. Then we may consider it if you really need that medication. But again, I'm not going to really push that medication. Sometimes we have, sometimes somebody has a protein in their urine, right? We know that medication helps with the protein in the urine. I always tell them, look, get the Sugar MD kidney support because we put all the vitamins in there. That also helps your kidneys, or your doctors will not tell you. But having said that, some people will need those other medications. But those are the people who are really towards the end of the road. Right? I feel bad for them because they already have significant kidney dysfunction. They may be having a heart failure. Sometimes you have to use medications to save the day because holistic stuff is, has to be an ongoing process. Not, holistic stuff just does not save the day like medications do sometimes. But again, don't want to be the one who just wants to save the day. Be the one who wants to prevent further problems and maybe down the road possibly stop medications. All right, so let's see. There's a lot of unrelated questions. I appreciate comments coming. I have no problem with that, but I'm having a hard time filtering through the pertinent versus non-pertinent questions. What do you suggest for constant yeast infections? Again, everything we discussed in today's video. You have to make sure that you have good lifestyle practices. I cannot summarize it all right now, which we did in the last 30, 40 minutes. But I will actually have a recording of this video. So if you think you missed something, because we pretty much touched base on all of these things, you can go back and watch it again. I'm sure you will find an answer to the question. Again, somebody asked a question here. I assume that they didn't catch it when I was saying, estradiol keep the vagina healthy. Yes, it does. If you are on systemic estrogen, that helps, unless you have contraindications to it. But for most women, even with the breast cancer, you can actually take vaginal estrogen. And that really is super helpful because vaginal health after menopause is super critical. And, I feel like women are not treated fairly, when women have no hormones, nobody cares. When men have no hormones, everybody screams, oh, you need testosterone, you need testosterone. Okay, well, what about women, right? When men catches a urinary tract infection or fungal infection, it's treated immediately. When woman catches something, they're like, oh, it'll go away, or, no. So we have to make sure women are more prone to these problems. Just giving an antibiotic or an antifungal and just go away is not a good approach. We have to make sure that that doesn't happen again and understand the root cause. Why did this happen? What can we do to prevent that happen again? Somebody said kidney function and some vaginal issues. Yeah. I mean, somebody said, actually, interestingly, they said that the kidney support is happening vaginal issues. And that is actually true because it has probiotics, right? So anything that has probiotics in it will actually help your. Now, why do we have probiotics and kidney support? Well, that's a question. Well, the reason is your gut is so connected to so many part of your health. If you don't have a good mucosal lining, if you are letting the bacteria and antigens and all that coming through the walls, this is your border, okay? So you have to have a good border protection. So if you are letting those through your borders, then it is going to create more inflammation, more work to do for your body. So when you have diabetes, you have a lot of oxidation, reactive oxygen species, advanced glycation end products. Your body is busy, your kidney is under attack from all these, and your kidney is trying to clean that. But when you don't have a good gut health, your immune system is not good to begin with. First of all, you're letting the bacteria or the other toxins in food, etc., in, right? And you don't have a good immune system. It's like you don't have a good military and you don't have good police. Oh God, that's not good, right? So what we are trying to do with the probiotics for kidney health, for vaginal health, all that is to strengthen your borders to make sure that the toxins do not get into your system. Okay, so can you explain more about your product? I don't know what product. This. So you're talking about the special for today. I mean, you can go to the website and check it out. Basically, the V Happy is a product that we studied and came up with. There are actually similar products in the market, a lot more expensive. Sometimes they package it better, they spend more on the marketing, and they can sell it for twice the price. But our company doesn't work that way. So we are trying to bring in the product, the high quality products with low margins. So this product has the probiotics we talked about, the prebiotic, the oligosaccharides, and then the cranberry extract, and a few other things. So basically, that is not it's not a miracle, right? So we never say, oh, go take the supplement, you'll be okay. Then that's not a good approach. You always have to do a lot of things right in your life, and the supplements are going to supplement it. Let's say you couldn't have enough probiotics that day. You couldn't have cranberry that day. You couldn't have enough good complex fiber in your diet that day. Those are the things that will supplement you, that will help you, but it's never a replacement for good health practices. Okay, let's see what else we have. Can you repeat the research group? I'm not going to repeat it because I think some people will get bored, but I would say go to diabetesreversalformula.com, and there you can sign up to give your opinion. You're not signing up for anything monetary. You're not paying for anything. This is a research group that we will send you emails, and we will ask you questions. We will make interviews with you to see how you can help the rest of the community to create a program to help reverse their diabetes. And eventually, once the program is there, then of course we are going to offer that program. We're going to continue to get your feedback, and that is the whole point of it. Somebody already using Be Happy, that they're happy. That's why we call it happy, right? So be happy. But I think that's pretty much all the comments today. There are a lot of comments, but I don't want to really take your time with those comments that you may not be interested to hear. But thanks for joining today. I'm going to end the stream. And again, remember, we have another hour or 15 minutes if you want to check it out, the product, and check the diabetesreversalformula.com as well. And please do me a favor, try to share our YouTube videos in wherever you can, in the Facebook and other places, because YouTube really cares about sharing. So sharing is loving. So if you want to show your appreciation, please do that. We'll appreciate that. And I'll see you in the next video, hopefully. Tomorrow we have another one. We're talking about keto tomorrow, and it's totally unbiased. I'm not going to piss anybody off. I'm not going to bash keto. Don't worry. But we are going to do a comprehensive review about how keto may or may not help you, and who's keto right and who's it not right. So make sure, even if you're not on keto, I think, watching that will enrich you and will help you. So we'll release that at 11 o'clock tomorrow. We'll see you then. Bye bye.